Welcome to the Pain Channel. I'm Yuji Okuno from Okuno Clinic. Today's topic is chronic prostatitis, a painful disease that can be suffered by men, and I'm going to explain this condition. Let's get started. When you sit on a hard chair, you may occasionally experience pain in your lower abdomen, perineum, or genital area. Or you may notice a slow urine flow, pain during or after urination, or pain near the anus. Sometimes you get such symptoms. This chronic prostatitis isn't uncommon at all, and in particular, many patients are in their 30s and 40s. Men are more prone to this disease, in percentage terms, with some reports suggesting that around 10% of people may develop it. So a relatively large number of people may get it. Now, as a first step, let's take a look at where the prostate is located. This is a simple illustration. It illustrates a pelvic floor and male genitalia at the bottom of the pelvis. Here is the bladder, the largest bubble. Urine comes out from the bladder through the urethra. Look just below the bladder, where the urine collects. There's a tiny round gland directly below. This is the prostate gland. Its function is, for example, to produce semen which nourishes sperm and adjusts pH. This organ has such a function and is located just below the bladder, behind the pubic bone, and in front of the rectum. Inflammation can occur here for a variety of reasons. There is acute prostatitis, which is caused by an increase in bacteria. It isn't that common and can be treated with antibiotics. Bacteria are said to be retrograde. They enter through the urethra and multiply here in the prostate gland. As I said, this can be treated with antibiotics and isn't very common. So let's see what other causes could lead to chronic prostatitis. Chronic means a condition that lasts for more than 3 months. Chronic prostatitis is a symptom that can't be cured even with antibiotics. There are causes other than bacteria. One example is riding a bicycle with a hard seat, sitting on a very hard desk chair, or even horseback riding. This repeated physical pressure in the form of pushing up from below can cause inflammation here. This is one of the possible causes. Also, having had surgery in the past can be another cause. Sometimes a tube to drain urine, a urethral catheter, is inserted up to here. Some people develop chronic prostatitis due to the stimulation of the prostate gland during this insertion procedure. Also, some people develop chronic prostatitis after a single injury, such as falling from a height and hitting their buttocks. Also, after cystitis, urethritis, or a sexually transmitted infection, inflammation remains in the bladder. The other issue is a prostate examination, which can be painful. There's a test called a biopsy, which removes small prostate tissue from the rectum to examine it. This can also cause prostatitis in some people. After some form of physical stimulation, such as germs, inflammation, even if the germs disappear and there's no irritation at the time, something like an old wound has formed here and can cause inflammation. Now, I'd like to draw something for you. Something like this. A prostate gland has been inflamed. Old wounds have formed here. Old wounds don't form all over, but form in spots. How do we find out? Through a special test. Taking an MRI using a contrast agent, a beautiful and normal prostate appears uniform, but taking a contrast-enhanced MRI for chronic prostatitis reveals something else, a jumble of white areas and dark areas. This shows, in fact, that it's chronic prostatitis. We can diagnose it. Regarding treatment, chronic prostatitis actually causes patchy inflammation. It spreads not only to the prostate gland, but also to the pubic bone, the lower part, the base of the penis, between the prostate and rectum, or around the anus, or the base of the scrotum, into these areas. It is characterized by an increase in blood vessels, not only in the prostate, but, as we have just seen, also in many other places. For this reason, people with chronic prostatitis have pain not only in the prostate gland, but also in the lower abdomen, or in the penis, or in the scrotum, or in the anus. Inflammation may also occur around the area where the sciatic nerve runs, resulting in symptoms such as numbness in the back of the thigh. If you have the contrast-enhanced MRI test, it can help to determine if your prostate has a mottled appearance due to the formation of abnormal blood vessels. Our treatment to reduce these blood vessels is a catheter treatment. By using a thin tube, a 0.6 millimeter intravascular catheter instead of a urethral catheter, our treatment reduces those abnormal blood vessels. For details, please take a look at the description. We have also included treatment examples. This is a very new treatment. Originally, there weren't many ways to alleviate chronic prostatitis. For example, trying not to stimulate it and paying attention to your diet, which are of course important. Additionally, there are treatments available to reduce abnormal blood vessels that have formed, so please take a look at those as well. So, that's all for me today. I talked about chronic prostatitis. If you have any questions, or if it was difficult to understand, please write it in the comments section. Okay, see you soon!